We are going to learn some important life-saving skills. Let me begin with a case scenario. We have this elderly person who was walking in the park in the morning hours. You are there too and you notice that this person has suddenly collapsed. How do you approach this case? Okay, the first thing is this person was walking in the park. He may have fallen on the road. Make sure the scene is safe for giving CPR. Okay, ensure the scene safety. So, you put the person on the side of the road on a flat surface. Once that is done, you are going to check for the response of the person. How do you do that? You are going to tap the shoulders of the person and ask, how is he? Hello, how are you? What's your name? You look for a response. If there is no response, then you are going to activate the emergency response system immediately. Take out your phone, call the number, ask them to send for help along with a defibrillator. Once that is done, start calling for help. If somebody is around, they may come and help you. When there is just a single rescuer, maintaining the circulation should be given priority. Whereas, if there are more people to help, you can prioritize breathing as well. So, the order of importance in case of basic life support is circulation on top, followed by maintaining the airway and then the breathing. We will now learn what is the next step after activating the emergency response. You are going to check for patient's breathing. How do you do that? You keep the fingers near the nostrils and you will feel if the person is breathing. You try to hear if that person is producing any agonal breathing. You will hear some noises if the person is trying to breathe with difficulty. Also, try to look at the chest for chest rise. Along with this, you are going to check the pulse. If it is an adult, like as in this case, you are going to check the carotid pulsation. How to do that? You are going to place your 3 fingers between the trachea and the sternocleidomastoid. You will feel the carotid pulsation there. If it is not there, that means the person is not having breathing and he is not having circulation. So, that means the person has had a cardiorespiratory arrest. What is the next step? So, before we go to the next step, let me tell you some more points. In case of an adult, you are going to check the carotid pulse. If it is a child, you are going to check the femoral pulse or the brachial pulse if it is a infant. Next thing, you are going to remember that all this pulse and breathing check should be completed within 10 seconds. You should not be wasting any time and begin with compressions if there is cardiorespiratory arrest. We will now learn how to give compressions. So, what I am going to do is, I am going to expose the chest, draw an imaginary line that passes between the nipples and using the heel of your palm, you are going to give the compression at the lower 2/3 of the sternum. So, you are going to place the heel of your palm, support it with the fingers of the other hand and start giving compressions like this. If you noticed, when I am giving compressions, both my wrist and elbow are straight and there is no motion happening neither at the wrist, elbow nor the shoulder joint. All the movement is happening at the spine level. So, after completion of 30 compressions, you are expected to give rescue breaths. How to give rescue breaths? There are many methods available. If you are in a park and if you do not have any gadget, invariably you will have to give mouth to mouth breath. How do you do that? You pinch the nose and try to open the mouth, scoop out if the tongue is fallen back and achieve a proper seal and blow the air through the person's mouth. When you do that, you are going to deliver 16% of FiO2. When you are doing that, ensure there is proper rise of chest. Okay. One more thing I want to emphasize, when you are giving chest compressions, make sure there is proper recoil of the chest. you are expected to give around 120 compressions in a minute, and you have to give 2 rescue breaths after every 30 compressions. In case of children, if there are 2 rescuers, you can give 2 rescue breaths after every 15 compressions. We will now learn how to give the rescue breath. So, I am going to use this bag mask valve device for giving the rescue breath. As you know, this is the face mask and this is the ambu bag. We are going to attach it like this, and this mask is going to cover the mouth and the nose, and you are going to hold it in this manner. I am going to make a C with my 2 fingers, and remaining fingers I am supporting the jaw, and I am tilting it like this, pressing like this to achieve the proper seal and to open the airway simultaneously, and I am giving the breath. So, how much breath should I be giving? If it is an adult, about 500 to 600 ml of breath is enough. For an infant, 100 to 150 is enough. Talking about the face mask, it comes in different sizes. For an adult, we use size 3 or size 4, size 3 in females, size 4 in males. This is just based on the person's face. Remember, there are 2 techniques to hold this face mask. First one is what I showed already, that is one-handed technique. You are making a C with these 2 fingers and pressing it down, and with the other 3 fingers which are resting on the mandible, you are just going to support the jaw. Okay. Some people will be obese or your fingers may be small, so you will not be able to hold the mask with single hand. In such scenario, you are going to use both your hands. How do you do that? Provided you have enough help to give the breath, you are going to make use of both your hands to give the breath. So, instead of doing this, you are going to press the mask with both your thumbs, okay, and you are going to lift the jaw like this. Remember, before starting bag mask ventilation, you are expected to open the airway. We will now see what are the airway opening maneuvers. The first maneuver is head tilt and chin lift. How do you do that? With one hand on the forehead, you are just going to tilt the head backwards, and with the fingers of the other hand, you are going to lift the chin. This will open the airway. Airway may have got compromised because tongue may have fallen down. When you do this, it opens the airway. Remember, head tilt chin lift is an important maneuver to open the airway. And also, from the exam point of view, in recent exams, many times they have asked this question. They have shown an image of this head tilt chin lift and they have asked what is being demonstrated here. In case of trauma victims, we should avoid doing head tilt chin lift. Instead, what we have to do is, we have to do inline stabilization of the spine first, because any trauma victim without proven otherwise should be thought of having a cervical spine injury. So, in such cases, instead of giving head tilt chin lift, we are going to give the jaw thrust. What is jaw thrust? You are going to place your fingers below the angle of the mandible and you are going to give a thrust, upward thrust like this. So, that will open the airway. Remember, these 2 airway opening maneuvers, they are very important. Please remember, you are going to do this 30 compressions and 2 rescue breaths for about 5 cycles. After 5 cycles, you will get tired and make sure the rescuers switch. That means, if you are giving compression, you go and take care of the breathing, and the person who was taking care of the breathing will now switch over and he will start giving compression. This ensures the quality of compressions does not go down. That brings us to another point, that is high quality CPR. What is high quality CPR? High quality CPR is providing good quality compressions. What should be the quality of compression? Each compression should be at least 5 centimeters deep or 2 inches deep in case of an adult. For a child, for an infant, it should be 4 centimeters, that is 1.5 inches. And one more variation, in case of children, the body surface area is small. So, you cannot be using your entire palm for giving compression. Instead, in case of children, you are going to use the 2 fingers or the 2 thumbs for providing the compression. You are going to place 2 fingers at the center of the chest along the internipple line and you are going to press down and hard. Okay. It should go 4 centimeters deep and the compression rate here remains the same, that is 120 compressions per minute. And when there are 2 rescuers, what you have to do is, you have to hold the baby like this, you have to encircle your fingers and with the help of thumb, you have to press in the center of the chest. That is how you provide compression in case of a newborn. I hope you have learned some important skills in this session.